Welcome everyone to Chapter 11. We are going to start Evaluation and Management. This section here is the beginning of your CPT book. This section covers physician payments. So one thing to keep in mind that these are not how a hospital gets paid. These are strictly how a physician gets paid, or possibly a nurse practitioner, physician assistant. So these are the codes that they utilize to get reimbursement. So let's go ahead and start. One thing you may want to do is keep your CPT book open, and it's right at the beginning. So it's the first section of your CPT book, the evaluation and management. So you can kind of refer back to the codes that I'm talking about. And one other thing is that there will probably be 3 videos of this. So they'll be 15 minutes apiece. That way you can take a little break in between videos. And the other thing is that you can always pause this and you can replay this tape as many times as you want. So one more thing before we dive in is that I have the laminated E&M worksheet. This is in shared files. It's in your content. And also in your content is the Chapter 11 PowerPoint itself. So let's get right into coding for services. So your job is to code what's documented in the medical record. Okay, nothing else. Don't dig to try to find other information. If you have questions, that's when you need to ask the physician. Don't make assumptions. This is great here. Optimize, never maximize. So you want to get the most out of that office visit or that ER visit, but you don't want to increase it or make it as great as possible. The documentation isn't there, because basically that is a crime and that's fraudulent. So a good example of this would be, let's say a patient had an office visit that day and they didn't show up. And the doctor at that point decided that since that patient didn't show up, they were going to charge him the full office fee. So you can't bill for services never rendered. Now I know sometime when you get into mental health, it gets a little bit, they can do some type of charge, but for your basic office visits, that type of thing, you cannot charge for. Okay, the E&M section, let's talk about that. This reports physician services, just like I talked about. What type of services are we going to look at? We're going to look at office. So when a patient comes to the office to be seen, we're going to talk about hospital visits. So this would be the initial time a patient's seen in the hospital. It would be also a consult. So if you are in, this could be an office or a hospital setting, a consult could be. So keep that in mind depending on, this is where the doctor would refer. So if you're an internal medicine doctor and the patient has heart palpitations, maybe they call in a cardiologist. So that would be a consult. 3 factors of E&M we'll talk about a little bit on each of these is place of service, type of service, and patient status. I do have little notes down here, so if you want a little bit more detailed, make sure you read through these in your PowerPoint because they are there. Okay, so the place of service, that's the first one, explains the setting of service. Was it done in the office? Did it happen in the emergency department or did it happen in the nursing home? Physicians provide many types. Okay, we have office visits, we have admission to the hospital, we have consults, prolonged services. One thing with consultations is that it is a request to obtain an opinion or advice about a diagnosis or management. I just gave you the example of internal medicine physician and possibly calling in a cardiologist to review palpitations. Patient status, we will get into these in a little bit more detail. We have a new patient, established, outpatient, inpatient. So let's go ahead and start right off here with a new patient. This is somebody who has not received any professional service in the last 3 years from the same physician. or another physician of the exact same specialty and subspecialty and in the same group. So let's give an example of this. Let's say I belong to a big medical practice that has over 300 different specialty doctors and internist regular doctors. So with that, I go in January to go see my OBGYN physician. I have my yearly check and I had issues. Okay, so then they would charge me as a new patient. Okay, because it's the first time, let's just say initial or first time that I seen this physician. And then 2 months later, I'm having issues with a rash. So I go to dermatology. It's at the same multi clinic, but since it's at the same clinic, it doesn't matter. They can still charge new patient. Okay, keep in mind because it's a different specialty. So let's say then 2 months later, I go back to my GYN doctor, gynecology, and I am having issues, but I see a different gynecologist. At this point, just because it's a different gynecologist, they cannot charge me a new patient, okay, because it's only been, we'll say, 3-4 months since my last visit. So if it's in the same specialty, then it cannot be a new patient. Okay? But if it's in the same clinic, but a different specialty, they can charge you a new patient every time. So then let's say I am having carpal tunnel issues and I go to the neurologist, new patient. Okay, then let's say I'm having issues with, I break my ankle and I go to the orthopedic surgeon, same, same multi-specialty clinic, I can be a new patient again. And if I have seen a physician, orthopedic physician at this clinic, and I haven't been there for over 3 years, I'm now a new patient again, even though I've been to this doctor before. The reason is they feel like that they have to work up a new history, a, you know, probably a new problem, maybe not, but the history is probably the biggest thing. So at that point, they are able to charge you for a new patient. Establish is you've seen professional services in the last 3 years, same physician or another physician of the exact same specialty and subspecialty in that same group, which I just kind of talked about. If anybody has any questions on this, make sure you give me a shout out in an email. Outpatient. This is one who has not been formally admitted to a healthcare facility. So this would be a patient who receives service at a clinic, same-day surgery center, possibly admitted to observation. With the outpatient, there's many different things that I want you to write down too. So you have an emergency room, that's considered outpatient. Observation is considered outpatient. Any office visit, new or established, is considered outpatient. So there's a lot of different scenarios that you wouldn't think, oh, an office visit, you're an outpatient. It is considered an outpatient. Okay, so let's go to inpatient. This is one who has been formally admitted to a healthcare facility. Example, hospital, nursing facility, the attending physician dictates an admission order. H&P is history and physical. Everybody should have had this in health records management. Request possibly a consultation. So inpatient is usually it's somebody who's been admitted to a healthcare facility such as a hospital or any other, type of healthcare facility. Levels of E&M. What are they based on? Okay, so we're going to start off here with the nature of the presenting problem. How do we figure out what to charge a patient? Always a great question, and the skill provided, okay, the time spent, it's 50% of that time is counseling or coordination of care, the level of knowledge to treat that patient. We have effort required and responsibility. So we're going to get into key components. Not every area has key components anymore. We'll get into that too. Every encounter contains varying amount of key components or contributory factors. So let's real quickly here look over at my E&M. As you can see, your initial visits here, and when you open up your CPT book, we have 99202 office visits for a new patient. So if you go into the office visit, this has changed this year for 2021. No longer are they looking at the history and the exam. They're saying if you did the appropriate history, such as, do you smoke? What's your social history? What is your past history? If they do an exam, appropriate exam for that medical decision making. So really with these two sections, they're basing most of it on average time and medical decision making, which we will get into. So if you can see here, I have it nicely written out for you on average time. Now we go down to office consults. That's going to be different when I start talking about that. Time's really not a component anymore, only if it's 50%. We are going to be looking more at what level the history was, what level the exam was, decision making, okay, and then 3 out of 3. So we'll talk about that when we get to those later on. But again, I would keep this little worksheet handy. It's a great tool. Okay, so here's an example of an E&M audit form. This was taken out. Your book's going to have it also. So one nice thing of this is used to access E&M services. I know it's a little bit harder to see, but with this we have the history of present illness. We won't go into that detail this year. We will go more detailed next year into advanced CPT. This year it's kind of nice because basically you are told what level of history they did do, what level of exam they did, and what level of medical decision making. But I would highly advise just to kind of review that. So encounters, more of each component factor, you have a higher level of service. Less of each component factor, and have a lower level of service. Move that over here. Okay, I did talk about the key components. We have history, exam, and medical decision making. So you can see here when you have your office visits, they no longer use those. They look basically, once again, medical decision making and time. So make sure you look at these. Your CPT book is going to say the same thing. The other thing here is when we start getting into, let's go down here a little bit more. Office outpatient consults, hospital care, we need to know the history, the exam, medical decision making. And then with these contributing factors, yes, they contribute. You just have to have some really good documentation to go completely off time on these lower ones. Okay, so history. This is our first component. Let's go ahead and talk about that. But what I'm going to do, I'm going to end this video and we're going to pick up on history on my next video.